When it comes to the ALARA concept, there's 3 radiation safety factors or measures that must be in place. First is time, second is distance, and third is shielding. Time is referring to the shorter amount of time of the exposure, the less amount of radiation the patient is going to receive. So this is making sure that if you're taking an x-ray on the posterior teeth, you have it set to the appropriate setting. If you're taking an x-ray of the anterior teeth, again, you have it set to the appropriate setting. Distance is referring to how far away we are from either the tube head or the primary beam. We know that as the operator, we should be at least 6 feet away from the tube head and perpendicular to the primary beam, or at a 90 to 135 degree angle away from the primary beam. That's going to ensure that we're at a safe distance away. If there is any scatter radiation that's being emitted, we're protected from that. Shielding has to do with some sort of a device that's in place, like a lead-lined wall or the appropriate thickness of the drywall for a particular wall, or something that's put in place that we're able to stand behind. If for some reason we're not able to be at the 6 feet away or perpendicular at the 90 to 135 degree angle, having those devices in place, we're able to safely take x-rays if we're not able to be at that appropriate distance. That's recommended. And also making sure that you periodically check the condition of the lead apron, of the thyroid collar, making sure that they're being maintained and stored appropriately. You know that the apron and thyroid collar, because they're lead lined, should not be folded. The folding can cause a crease, which actually causes breaks or cracks within the lead lining, which then diminishes the efficacy of the lead apron or the thyroid collar. So just making sure that you're following appropriate protocol at all times. Again, the whole purpose of ALARA is to minimize the exposure of radiation to not only the patient, but also to us as the operator.